Thank you, Chairman. It's my honor to give this presentation today. The title of today's presentation is A Scoring System to Predict the Postoperative Complications After Laparoscopic Liver Resection in Elderly Hepatocellular Carcinoma Patients. Nothing to disclosure. In recent years, life expectancy has increased worldwide, and the frequency of laparoscopic liver resection in elderly patients is increasing. However, the postoperative complications after laparoscopic liver resection in elderly patients remains a major issue, as aging causes the great prevalence of comorbidities and decreased physiological reserve. Therefore, there is a growing demand for predictive factors of postoperative complications that can enhance informed decision-making. The Geriatric Nutritional Risk Index is an elderly-specific index that has been proposed to assess the nutrition-related risk of morbidity and mortality for elderly patients in hospital. The relationship between GNRI and postoperative complications in patients with ATC after laparoscopic liver resection in elderly patients has not yet been reported. Therefore, the aim of the present study is to investigate the clinical significance of the GNRI in laparoscopic liver resection in elderly ATC patients, and to propose a new simplified scoring system using GNRI for predicting the postoperative major complications after laparoscopic liver resection in elderly ATC patients. We retrospectively reviewed 257 consecutive patients aged more than 65 years who underwent laparoscopic liver resection for ATC from January 2004 to December 2019. GRI was calculated as follows. All laboratory and demographic data used for calculating the GNRI were obtained within 2 or 3 weeks before surgery. The GNRI which classified the patient in the following 4 groups based on the GNRI values: high risk, moderate risk, low risk, and normal group. In this present study, patients who had the postoperative complications within 30 days after surgery were graded using the Clavian-Lindo classifications. Major complications were defined as equivalent to the CD classification grade 3 or higher. Let me move on to our result of the present study. A total 219 patients met the inclusion criteria and were analyzed for the study. Among the study cohort, 24 patients had major complications based on the Clavian-Lindo classification. This table shows the clinical data of patients. In the preoperative data, the complication group shows the significant Flowchart pulse score and serum albumin level, and the proportion of the patient with low GNRI was significantly higher in complication group. In operative data, more patients in the complication group underwent major resection, and the complication group was significantly longer in operation time, more blood loss, and intraoperative transfusion rate than without complication group. Risk factors of major complication are shown in this table. In the multivariate analysis, chart pulse score, GNRI, resection type, and intraoperative transfusion were identified as independent risk factors for major complications. The risk score system that was developed to predict major complications is shown in this table. Variables with the statistical significance on the multivariate analysis were included for risk score system. Odds ratio from the multivariate analysis were translated into corresponding risk score point to create the risk score system ranging from 0 to 10. In the overall quote, although the GNRI was a significant predictor for postoperative complications in multivariate analysis, the AUC of GNRI was 0.365, which indicate the very poor model, while the risk score system shows good predictive values as demonstrated by an AUC 0.756. This figure shows that the risk score system also shows good calibration of observed risk and predictive risk score. That brings me to the end of my presentations. The GNRI is an important predictor of postoperative major complications, and the proposed risk score system can help to predict the risk of planned laparoscopic liver resection in elderly hepatocellular carcinoma patients. Thank you for your attention.